the five issues that were identified from the Alliance are really all very intermingled. It's a very chicken sort of egg situation. But obviously we have a critical shortage of frontline healthcare workers. For us and anybody that's been in the industry from before COVID, we all know that this was a problem pre-pandemic, but it's certainly been punctuated now. Providers are reporting something like 50% of referrals are being turned down at this point solely because they can't staff them, not because it's, it's not a case that they're comfortable with or they can't go that far, or it's an area they're not in. This is simply because they can't staff it. So that's just massive, just a huge, huge problem. So compensation, again, notoriously low for, and if everybody on today or who's listening is involved in home care, I'm, again, preaching to the choir, notoriously low in home care. Wages really need to be lined up with the value of the role. And we're going to talk about value of this population again in just a little bit. But I think that's sort of the bottom line. But if you look at, so let's take nursing wages first. You look at nursing wages in home care, generally speaking, and Home Care Pulse obviously has great data to support this. But nursing wages are, any nurse could go work in a facility, whether that's a hospital, a skilled nursing facility, whatever, and generally make more money. So it's really, we really have to look at other areas of why it's so much better to work in home care. What's more rewarding about it? What's better about the flexibility of it? Any number of things, right? The same is true for home health aides and caregivers. Many areas, these workers are still being paid minimum wage. So again, leaves very, very little incentive to come into the industry at all. When you can look at, okay, so if I can make, let's just use a round number, $10 working for this home health agency, or I can make $10 at the Gap, maybe I'll go work at the Gap. So it's just, we need to be a little bit more creative here. Certainly, there absolutely needs to be more opportunities for these folks to develop, to improve their skill set. Study after study shows that more home care workers are incentivized by career opportunities or career ladders, if you will, just as much or nearly as much, at least, as compensation. It's not just all about compensation, though compensation is very important. But you see the providers that offer continuing education or other opportunities like that, and they're the ones that end up keeping the staff the longest. Professional perception, and I think we can look at this as a sort of twofold, from the industry perspective and from the public perspective. Because the perception is incorrect on a number of levels from both areas, right? From the public's perspective, and right now I'm talking about more of the home care aide population as opposed to the nursing population, because when you call somebody a nurse, when you say she's a nurse, then people say, oh, okay, well, she's got a license and she went to school, and that's not the going thought when you talk about home health aides or personal care aides or certified nursing assistant. Certified nursing assistant gets a little bit of a bump, but when if you talk about the caregiver homemaker population, if you ask a client what their home health aide does or what their home health aide's title is, you'll get a whole host of responses, from cleaning woman to housekeeper to grocery shopper to, but so the perception is that that's such, and I hate to say this, but it's such a low level of service. And it's really one of the most critical levels of service. That person spends the most amount of time with these clients or patients, or again, whatever they're being called. They know them more than any of their professional, like their therapists, their nurses, not to discredit what therapists and nurses do, because they're amazing. But I think the role of the caregiver absolutely has to be elevated. It is a professional job. Sure, maybe you don't have to go to school for years to learn how to do it. But you certainly do have to hone your skills over time to do it right and to be really good at it. And they're a huge part of the team, no matter how you cut it. I think that it almost goes without saying, right? So like I mentioned earlier, we've got providers saying that they're turning down, a full half of the referrals that they're getting because they can't staff them. So what does that mean for those families? Obviously they're having to look for alternate ways to care for this loved one. So many people are having to, quit jobs or work less to take care of their own family members, et cetera, et cetera. So it's huge. I think the last number I saw that said that there would be an estimated need for 8.2 million more jobs to keep up with the demand of people aging. And I mean, obviously people want to stay home. If the pandemic showed us nothing, it was that people don't want to go into facilities anymore. They want to age at home. No offense to the facilities, but people would prefer to stay home.